Welcome to the Wow MD podcast, where in each episode, you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Hello, listener. This episode is an update about body contouring. And if you don't know what body contouring is, let me explain it very clear in this episode. And then what I'd like to do is give you some ideas of what are the possible means of obtaining body contouring. So this episode is all about the principles of body contouring, the pros and cons of surgical versus non-surgical laser therapies. And then the second episode, we'll be getting into detail about various technologies that are available out there, the pros and cons of each one of them, and a little bit of detail like how much it would cost. First of all, right off the bat, body contouring, it is not at all similar and very different than weight loss. If you do body contouring and you decide to have a body contouring procedure, you're not really looking to lose weight. You're not looking to lose 30 to 50 pounds. You're looking to reshape your body and get rid of stubborn pockets of fat. That's what body contouring is. That's the purpose of it. Now, you go under the knife and you have a significant surgical procedure that removes tons of fat all around your belly. And that is a shaping procedure, but it's a major surgery. And technically it's a weight loss because if you dump 20 pounds or more, that is a weight loss procedure technically. However, the risks are enormous. And we'll talk about that in a second. So again, weight loss, body contouring. And you might say, well, that's about the same thing because when you lose weight, your body kind of looks better, right? It has a better shape. And that is totally and completely true. Losing weight will change the shape of your body and will make you look better because you will lose some of the undesirable weight that you have accumulated overall. However, keep in mind that when you have a major weight loss in the range of 30 pounds or more, especially in the range of 50 to 100 pounds, things drastically change and some of the weight loss will always be muscle mass. Another problem with the weight loss, and please don't get me wrong, I am not against weight loss. I'm just pointing out some of the unintended consequences of losing a significant amount of weight all at once and usually in a few months or less than a year. We all want that, but that is bad for us. When that happens, the skin that has been stretched by the fat might also become much more loose. And considering that you're losing some muscle underneath that fat and underneath that skin, there will be the unintended consequences of really flabby skin that you might have to take into account and deal with. There always will be areas of fat that will not go away unless you lose a large amount of weight. And those are the stubborn areas, our abdomen, our arms, our thighs, and the body trunk fat right by our bra roll. So when do we need body contouring? Well, whenever you have undesirable pockets of fat that have been resistant to weight loss, resistant to exercise, and they're obvious to you when you look in the mirror and they bother you. They might be obvious to you, but they might not bother you. And you might be like, you know what? I like my shape. You don't need to do body contouring if that's the case, right? So for most people, let me give you a few examples. Belly fat is a really big problem. And it's a big problem for many overweight men and women. However, you see many people, men and women, who are not really bothered by the belly fat. Where if they are, they have decided they don't want to do anything about it. They might wear baggy clothes, or especially in the case of men, they wear it very proudly. They say, well, this is me now. I'm an older self and put up with it, right? I do believe women are much more likely to act on their belly fat than men because the idea of a trim and slim waist has always been a criteria for beauty of the body, whereas men don't necessarily believe of themselves as needing a slim waist as women do. They're actually more proud of their biceps, their hairline, other things, right? Another area that is significantly bothering mainly us women are the love handles. Everybody knows that the love handles are the area of the hips that is right underneath our waist. And there are various reasons why this area is very bothersome to women, because we're wearing low waist pants and it could make this area stand out. Wearing a tight fitted dress instead of the dress highlighting the desired hourglass shape that you want to have, it will actually highlight the love handles. So women literally hate love handles. There are fat pockets on the trunk that many women on our thorax, on our chest, at the back specifically, that women are bothered by, especially what we call the bra roll. There's smaller rolls of fat, very apparent above and below the bra line, under the armpit or on the body. And if you're wearing a tight top, well, guess what? They do show quite a bit. Also, women are highly bothered by the fat on their upper arms, especially because come summer, and the release of this episode, it's around the April 13 weekend. Hey, we're in spring here in California. Summer's coming, right? So everybody is going to start wearing sleeveless or very short sleeve shirts. So many women, as they wear summer dresses, believe their jiggly fat on their arms is very unsightly. So as far as the arms go, and especially the fat pockets in the arms, in many cases, as women get older, keep in mind that it's not just fat. We lose muscle mass, and especially if we stop working out with weights, we will get more skin laxity in the area. And that's a contributing factor to this jiggliness that I think there was a movie with Cameron Diaz. She made a lot of fun of it. Well, last but not least, there are some fat pockets around the knee, on the inner and the outer thigh that bother women quite a bit. And believe it or not, there are quite a few women embarrassed to wear shorts during the summer because they don't want to show up their knees or their lower legs. And what they personally believe it's not pretty. So again, for all these specific areas that I mentioned, especially the arms and the legs, when we lose muscle mass and the contributing skin laxity as we age, all of these are factors that will contribute to that specific appearance of very loose, wrinkly skin and a change of shape in an area that you have looked at for many years in the mirror, now looks completely different, can be highly bothersome to you. But guess what? We have technology to help you get back in shape and get the shape that you're looking for. Obviously, there's an expectation that as we get older, our body will change. And there's a belief, in some cases, that nothing we could do is going to slow down time. However, that's not true. There are many things that we can do to slow down the aging process, improve our muscle mass, improve our skin quality, improve our appearance while we attack those undesirable pockets of fat and definitely make our body look better. I would be completely remiss and ignorant of the fact that women want their neck to look a lot better as they age, especially if there's an undesirable pocket of fat right underneath the chin. Well, guess what? You do not need surgery to fix that. All you need is a good body contouring device that works for you. And you need to have some ability to tolerate either the heat, the extreme cold, the needles, or maybe a mini liposuction if that's the case. So this is a segue and it's tying me up into the next things that I want to talk about. So let me say a few words about liposuction. And it's more than a few words. As a physician, as a woman, and as an educated person, I have certain beliefs of what would be right for me and what wouldn't be right for me. And I'm sure you do the same. So what you're going to hear about liposuction is my own point of view, and I'm going to present you with some pros and cons. Don't let that overrun or trump your own point of view on this matter, okay? Liposuction is a valuable body contouring tool. However, other than the advantage of a super fast reshaping, other than getting the results you want in a matter of 1 to 2 months, it has many, many disadvantages. So let me start with the most obvious. Liposuction is extremely expensive. We're talking tens of thousands of dollars. And if you're throwing in a tummy tuck, you're now in the upwards of 30 to 50K. One of the major advantages of body contouring, it's much cheaper than the liposuction. Another very obvious disadvantage of liposuction is the significant discomfort and at least a few weeks, if not a whole month, maybe more, of some downtime. A clear advantage of laser body contouring is the immediate return to normal daily activities. That includes your regular workout, no pain, no scar, and hello, you had me at those two advantages. But let me keep going. Another very clear disadvantage to liposuction is the fact, and this is maybe what you have not heard before or considered before, there is a significant surgical skill needed to complete a liposuction well. It needs to be this surgical skill blended with some artistry and a lot of experience. And all these three things are required for that perfect result that everyone hopes for. Let me tell you a little bit about my first impression on liposuction. That happened when I participated in a hands-on training on liposuction back in 2012, when I was working for the community center, but I was planning on opening my anti-aging aesthetic medical practice. And let me describe the procedure for you a little bit. This involves the patient being either asleep or under general anesthesia or significantly sedated and possibly just heavily medicated for pain control. This involves a sterile field, maybe an anesthesiologist that will monitor and supervise the patient's comfort and sedation during the procedure. So it involves injecting a significant amount of lidocaine mixed with bicarbonate solution to dilute this lidocaine and create what we call tumescent anesthesia. This is the process of intentionally plumping up and swelling up the area that we want to extract the fat from. And then there's a small incision that's being made surgically, and the surgeon will introduce a cannula through which the fat is extracted. Most of the times, the cannula is connected to some sort of a suction device, and the cannula is moved in and out, back and forth in various directions. And obviously, this is the point where the skill, the technique, the experience, and the artistry come hand in hand and need to fall into place, because it is so easy to do that in a poor, sloppy, and uneven fashion and end up with an uneven result in a lumpy, badly masked area you tried to make look better, and now it looks horrible. Now, most modern liposuction technology involves some form of laser energy that actually destroys the fat and can break down the bands of cellulite, also tightening the skin with the help of the heat delivered under the skin. However, consider the fact that the depth of the penetration into the tissue with the cannula, the evenness of the motion, and applying the same energy uniformly and equally to the entire area means a skill that has been honed to perfection by many procedures, and an eye that will keep the hand moving in the right places, at the right angle, at the right even speed, etc. On the other hand, again, always playing devil's advocate, on the other hand, devices like sculpture require minimum training, a minimum level of education for someone to simply apply the applicator, put it on, turn the energy up, adjust the energy level based on the patient's preference, the patient's tolerance, the outcome desired, and just supervise that there's no issue. Some of the body sculpting devices like Morpheus Body requires more skill, but a well-trained and a well-versed nurse can easily operate the device with minimum to no supervision, as the skill of applying the applicator and deploying the needles is one that is easily learned and easily perfected. We do need an MD for the liposuction, someone with a steady hand and a good eye, someone that's board certified in ideally plastic surgery. We need someone that's a perfectionist and an artist. Now, I am a perfectionist and I believe in minimally invasive technology. And in my opinion, liposuction is as invasive as it could get. But let me continue talking about some other disadvantages. What about the risk of infection? This is a major disadvantage for liposuction. The risk is low, but is a consistent and major problem. You make an incision in the skin, even though the skin is super cleansed, isolated in a sterile field. This movement of back and forth increases the chance that skin bacteria will contaminate the inside, creating the conditions for an infection. Now, there's a case that comes to my mind, and I want to share with you today. This is a rare story of a liposuction gone wrong, probably an outlier circumstance. But I remember clearly to this day, a young woman in her late 30s, a single mom, slightly overweight, that wanted a consultation for body contouring. I sat down with her. This was probably about 6 years ago. I gave her an assessment and explained the procedure, explained the fact that it will take about 3 to 6 months to complete because she had significant amount of abdominal fat, and I discussed the cost. She chose to go for liposuction instead. It was a physician somewhere in Los Angeles. She unfortunately came back later for a pelvic ultrasound and a regular GYN consultation. She was suffering from a significant complication due to liposuction, was extremely distraught over the situation. She was almost embarrassed. I believe at the beginning she was hesitant to discuss the details of what happened. because she believed I was going to tell her, I told you so, you should have done the body contouring instead. Obviously, when she revealed to me what was happening, my concern was how to provide advice that could help her heal the situation faster, and that's exactly what I did. I never pointed out the obvious, hey, you should have listened to me, gotten the risk-free body contouring procedure. I am not that kind of person. It would have been very petty and against my belief as a doctor. But unfortunately, let me get back to the patient. She developed an infection with the flesh-eating bacteria. Part of the skin where she had a tummy tuck incision was literally missing. She had a large, probably 10 centimeter wide and about 10 centimeter long, 5 centimeter wide, gaping hole with a red granulation tissue. She really didn't know what to do. She was pretty desperate. She thought the doctor that created the problem, that offered the surgery to reconstitute the area that she wanted to go back to, actually wanted to charge her more money to fix the problem. So obviously I recommended a wound vac to help heal her in a hyperbaric oxygen chamber. And I tried to provide referral to other plastic surgeons that would do reconstructive surgery. She needed to have reconstructive surgery at this point. Unfortunately, this was before I had any knowledge of healing peptides or BPC 157. I probably could have helped her more. But I did tell her that if she ended up with a bad scar, I'll be happy to offer her a significant discount for the scar remodeling, considering the fact that she was a single mother, she was my patient, she was finding herself in this horrible situation. Again, this is an outlier. It's a very rare but unfortunate possibility when you consider liposuction. More so, sepsis is an acute, life-threatening septic process. It's a possibility. Super rare is still a reality. So you can actually go under the knife and aim for a beautiful, better body to actually die. So that's not cool, all right? One of the main advantages of body sculpting with any laser device that uses either heat or cryoenergy to destroy the fat, they don't penetrate or injure the skin. So such a circumstance of a severe infection is not possible. As always, when we do a procedure, we think safety first. And that's what the body contouring devices are all about. Providing results, but in a safe, comfortable manner with minimum to no risk, no pain, as well as no downtime. Now, I'm going to end this chapter on liposuction. I'm going to quickly mention other possible complications with liposuction. Risk for hemorrhage, risk for cutaneous necrosis, risk for thermal injuries or blistering. I haven't even touched on the risks of nerve damage, muscle damage, the risk of uneven pigmentation, the risk of poor wound healing, the risk of rippling or very loose skin, risk of worsening the cellulite, and last but not least, risk of some major general complications like deep venous thrombosis, as well as other possible consequences that are life-threatening, like cardiac and pulmonary complications. Let me tell you one thing that you might not know about liposuction. Let me just discuss for a second fat embolism. This is where a small fragment of fat enters your bloodstream, potentially traveling to the lungs or other organs and causing a blockage of the blood flow. This type of blockage can cause permanent damage either to the lungs or the organ where it's lodged into, and the patient will experience either significant respiratory distress like difficulty breathing or possible neurological impairment like confusion and seizures if the fat blockage occurs in the brain. Fat embolism is rare, but the mortality rate is estimated to be around 10 to 15%. And apparently, when I researched how frequent fat embolism is, it can occur in up to 8.5% of patients undergoing liposuction, especially in patients that are removing a large volume of fat. Probably not like a little shaping of the thighs or the arms, more about the belly fat. So please beware if you ever consider liposuction. Refer this person that's considering liposuction to my episode and have them do their due diligence, do a lot of research before they decide to go this route. So coming back to my training for liposuction, as soon as I saw this procedure unfolding, I decided right then and there, this is not for me. I have always been of the mind that if I would never subject my body to something, then why would I ethically offer it to my patients? Simply for making money? The answer was no. I believe now, just as I did 13 years ago, we have so many available body sculpting devices, especially now, 13 years later, that are able to achieve similar results to liposuction without downtime, without post-procedure pain, without any scarring, and without the risks of tumescent or general anesthesia. without all these major complications I just mentioned. So it's literally a no-brainer that liposuction is likely to be a thing of the past, or a technique that will likely be used mostly in cases of women who want to go away for a vacation, so to speak, and then come back a different person. So everyone will be wowed and amazed at their transformation. Most women, and I'm talking about 95% of women, want no pain, no downtime, no scars, and no risks. They will choose body contouring technology instead, and they will take the time it needs, and they know that great rewards come to those that wait and take it slowly. After this short parenthesis about liposuction, let me discuss the mechanism of killing fat, specifically localized fat, with various technology. Let's put it all under the umbrella of laser technology, even though all the body sculpting technologies are through laser technology. There are different devices that do different things, and not all of them are lasers. We can destroy fat cells by exposing them to either too much heat or too much cold. There are other technologies out there too. We'll talk about those in the next episode. But let me keep it simple today. As you know, if you're subjected to a very high temperature, you will not survive. You will dehydrate, you'll dry up, you'll pass out, and then die if you're exposed to a super high temperature. If you get exposed to a low temperature, too low for the human body to survive, your body will slow down, your blood flow will cease flowing, your brain will be deprived of blood, so slowly you'll fall asleep and die. So this is common sense. You know this. I'm just repeating what you already know. If you live somewhere in the world with 4 seasons where it snows, you know you need to protect yourself from the snow. You cannot lie down and sleep because it's very dangerous, right? If you live in a very hot climate like the desert, you know you can't lie down in the hot sun and fall asleep. Something really bad will happen. It's called sunstroke, heat stroke, right? Then you die. In a similar fashion, subjecting our fat cells in certain areas to these extremes of temperature will cause their destruction. This is not a shrinking of the fat cell. This is permanent destruction. And this is a good thing for beauty, because you don't want to have a procedure and then come back and do it again later, because now you have more fat cells that pop out of nowhere. Even though there probably are people out there who just do that constantly, if that would be the case, right? But that's not the case. What happens is that we have a very limited amount of fat cells. When those fat cells die, that is an irreversible thing. They're dead, they're gone, they are disappeared. So the area where the fat cells were located will shrink after their death. We bank on that. That is a desired effect of all the technology out there. However, let me address this with the fat destroyed in one place and then moving to another place that I hear sometimes. As we continue to live and we continue to work out less or eat more or hormonal imbalances, etc., we can continue to gain weight. Whether you're a woman or a man, regardless of your gender, you probably know that as you get older, we're prone to gaining weight. Our metabolism slows down. We stop burning our calories as efficiently as we used to when we were younger. We lose our anabolic hormones, estrogen, testosterone. We lose our growth hormone. We start having fun not by organizing bike rides with our friends, going out dancing or hiking in the hills or mountains. Now, what we do for fun is going out to eat or sit down in a movie theater and then we eat and drink, or we go to a play or a show where, guess what? We sit down and during intermission, we drink and we eat. So as we gain weight, and again, that's not just as we get older. We can gain weight when we're younger for various reasons. But like I said, we gain weight. Our fat cells, the ones that we have left, in the same area where we destroyed the fat, they will swell up with the new fat. We don't gain new fat cells. We swell up the remaining ones with new fat. So we deposit more fat in the remaining fat cells. If you had body sculpting, you might ask, wait a minute, now I shave my belly, but my hips are growing. And now I have a bra roll. So is the fat moving up after body sculpting? No, your fat cells do not move. They do not circulate. However, if you have a significant fat cell destruction with lipo or body sculpting, the remaining fat cells will swell up in that area, but not as noticeable as they would in other areas because you have less fat cells. So to you, it seems you're gaining weight or the fat has moved, but it's simply because by gaining weight, the remaining fat cells obviously swell up and balloon with the fat accumulation. To you, it seems you invested all this time and work and money into destroying your belly fat to now have fat over your hips, your upper trunk, or your arms. The fat has not moved. You simply gained weight in other areas other than the area of body sculpting. This brings me to a very important point that I want to make about body sculpting, because I did say earlier that body sculpting with laser technology or any technology, including liposuction, is not a weight loss procedure. And I'll end here on this note. We humans have a very strange relationship with food, and whatever caused the weight gain and the undesirable fat accumulation on the belly, the thighs, whatever area it is that you're getting sculpted on, once that goal is achieved and you look better and feel better, guess what? If nothing has been done to address the key issue, which is your relationship with food, your relationship with exercise, your relationship with stress, the possible inflammation in your body, the possible leaky gut, the possible hormonal imbalance that you have, the possible mental issues like anxiety, anger, frustration, disappointment, depression, all the negative emotions that alter our relationship with food, with exercise, with hormones, and ultimately impact our health. If nothing has been done to address all of these things, then it's a problem. For every client that comes to us for body sculpting, I personally train my staff, or me if I'm personally doing the procedure, to have a conversation about all these issues. Because obviously, if there are additional pitfalls, and we do this procedure, but then, like I said, you continue gaining weight or have other areas, I don't want you to necessarily come back and do more treatments now on your arms or your thighs or, whatever. I really would like for you to be aware of what is going on in your body and act on it so that the ultimate results that you get as far as body shaping are pleasing to the eye and are long lasting. Hopefully this overall view of body contouring has been useful and you've learned some interesting things. And come back next week. I will get deep down into the trenches about all the technologies available, the pros and cons, the cold one, the heat, the electromagnetic ones, everything that I know that is available. So I look forward to sharing that with you next episode. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.